First, we will start from the antagonist of anticoagulant of direct and indirect action, protamine, sulfate, and vitamin K. Indirect anticoagulants are only administered parenterally. The mechanism of this action drug only affect the matrix degradation, and the anticoagulant, whenever oral anticoagulant or the directly acting oral anticoagulants include thrombin inhibitor and the factor XA inhibitor, direct oral anticoagulant, and the anticoagulant therapy donates the administration of a drug. The anticoagulant with the aim to inhibit the coagulant and the clotting of the patient blood. The effect of anticoagulant is based on the influence of the plasmatic coagulant of the patient. The influence to the plasmatic coagulant factors that reduce the inhibit clotting activity, anticoagulant in existence, and development of vitamin K coagulant, indirect anticoagulant, and direct anticoagulant. Vitamin K anticoagulant antagonist. These anticoagulant belongs to the group of Camerons. These suppress the vitamin K dependent synthesis of the coagulation factor and thus exert an inhibitory factor. The dosage form is a daily tablet intake, regular blood withdrawal during the determination of INR value define the dose. Then we will come to the direct and indirect. Direct anticoagulant, these drugs interverse in the coagulant cascade, the inhibit direct specific clotting factors such as factor and the thrombin second A current research. And then we will come to the indirect. Heparins are only administered parenterally. The mechanism of action is based on the increase in activity of endogenous antithrombin. Anticoagulant effect is therefore dependent of the patient antithrombin reporting. Depending on the molar mass, heparin and distinguish between the unfractured heparin UFH and the low molecular weight heparin LMWH. Measuring LMWH levels may be useful in certain situations such as renal failure, underweight, overweight, obesity, bleeding complications, thrombosis despite children, and the next we will come to the fibrinolytic drug. Fibrinolytic agents are used to break down the thrombus with the common agent became the reticulase, altiplase, streptokinase, and the urokinase. Common side effects of fibrinolytic are hypersensitivity reactions and bleeding. And there is an extrinsic and intrinsic part leading to the common pathway are outlined. Commonly used fibrinolytic agent include the altipase, streptokinase, uricane. Each fibrinolytic agent is viewed including indication for use, mode of action, mode of administration, and dosage, side effect, and the contraindications. This enable the reader to be well informed with fibrinolytic agents and their uses are provided up to date. Then there is come of mechanism of fibrinolytic activities. Fibrinolysis is the process of pyrolytic digestion of fibrin aimed to dissolving a clot or thrombus to restore the blood flow. The central enzyme is fibrinolysis is plasmin and serine protease form the inactive precursor plasminogen upon the action of activators triggered by the various pathologic stimuli. And the mechanism of thrombolytic drugs dissolve blood clot of activating plasminogen, which form a cleaved product called plasmin. Plasmin is a pyrolytic enzyme that is capable of breaking cross-link between the fibrin molecules which provide the structure integrity for the blood mechanism. Then the come features of the action of the tissue activator, fibrinolysin. In the tissue fibrinolysis originally referred to the plasminogen activators, and the fibrinolysis stability of fibrinolysis is strictly different from the proenzyme. At room temperature, the neutral pH, 25% of the original activity may be lost in 8 hours. A rapid anti-digestion, which is maximal and neutral pH agents such as ECA, glycerol stabilize both the proenzyme and fibrinolysis. And the degradation product of the fibrinolysis react with the antibody to fibrin and the parent molecule Several investigators also found the electrophoretic mobilites of the various product classes product change into the time permitted. And then come the inhibitor of the fibrinolysis. Antifibrinolytics such as the aminocaproic acid and the tranexamic acid are used as inhibitor of fibrinolysis. This application may be beneficial in patients with fibrinolysis because they are bleeding rapidly if their component of the hemostatic system are not several effective. And then inhibition of fibrinolytic system may occur at the level of plasmogenic TP and plasmogenic NV activator or directed by thrombin plasmin. And then we will come to the 7 question, their indications, principle of action, caporic acid and increased fibrinolysis indication, and also included the side effect. Indication of the fibrinolytic therapy is used in the treatment of ST segment elevation, myocardial infarction, stem 1, acute stroke, and the less common indications such as pulmonary embolism and acute deep venous thrombosis. And fibrinolytic therapy is treatment of choice for the someone patient who meets specific criteria. Patient has been symptoms chest pain from the lower 15 minutes but less than 12 hours. ECG is diagnosed for ST elevation indicating MV and left bundle block. And then we will come active bleeding or the bleeding diathesis excluding menses, a significant closed head trauma or the facial trauma with 3 months, intracranial or interspinal surgery with 2 months. And then example are the minase, replace, revertase, streptase, TPA, and the bokinase, kinetic ricokinase. These are included. The mechanism and the action of the aminocaproic acid with increase of fibrinolysis. Ma'am, complete. Ma'am, I will start from fibrinolytic drugs. Fibrinolytic drugs, a drug also called as a thrombolytic drug, any agent that is capable of stimulating a dissolution of a blood clot. Fibrinolytic drug work by activating the so-called fibrinolytic pathway. This distinguishes them from the anticoagulant drugs, which prevent the formation of blood clot by suppressing the synthesis or function of various clotting factors that are normally present in the blood. The fibrinolytic system that exists in the human body is also involved in the lysis or dissolution of clots as wounds heals. The fibrinolytic system degrades fibrin and fibrinogen to produce that act to inhibit the enzyme thrombin. The second question is, ma'am, mechanism of fibrinolytic drug. Mechanism of fibrinolysis of fibrinolytic drug. Fibrinolysis is the process of proteolytic digestions fibrin aimed at dissolving a clot or a thrombus to restore the blood flow. The central enzyme in the fibrin lysis is plasmin, a serine protease formed from its inactive precursor plasminogen. Upon the action of activators triggered by various pathologic stimuli, plasmin leaves a variety of substrates other than fibrin and is involved in biologic processes beyond hemostasis and thrombosis. There are a number of mechanisms to moderate the activity of fibrinolytic enzymes that may become ineffective in various diseases when the ratio of pro and anti-fibrinolytic compound in blood is imbalanced. Hyper or hypofibrinolysis is developed that causes an or exacerbates hemorrhage or thrombosis, respectively. Diagnosis of fibrinolytic disorder builds on clinical symptoms along with molecular markers. And then we have other question is, yes, features of action of tissue activator. Uh, um, Mechanism of action of some improvements in preparation of tissue activators and plasminogen and termination of activation by epsilon amino caprioc acid have permitted the use of a quantitative casinolytic assay from the measurement of the plasmin form. The following to indicate that the activation of plasminogen by tissue activity is catalytic. Catalytic. Uh, a biphasic curve obtained when velocity was plotted against the plasminogen concentration. B. First order kinetics. C. Dependence of the turnover number on tissue activator concentration. The temperature and pH stability of tissue activator were similar to those reported for urokinase, since both of these enzymes have now been shown to activate plasminogen by the catalytic mechanism. These data support the suggestion that urokinase may be an excretory form of tissue activator which has been released into circulation. And the last one is inhibitors of fibrinolysis. The inhibitors of fibrinolysis form an integral part of the fibrinolytic system, maintaining a state of dynamic equilibrium with the activators. Studies of their presence are reviewed. Data on their role in tissue repair is also present. Among the different inhibitors against fibrinolysis, urokinase was found consistently to be of a higher level in platelets and cultures from tissues taken from all parts of the body. The urokinase inhibitor was also found to be high in plasma of a variety of physiological and pathological conditions uh, predisposed to thromboembolism. These conditions include late pregnancy, various cancer stage, and sickle cell disease. It is concluded that urokinase, along with its inhibitor, forms an integral part of the physiological hemostatic mechanism of importance not only in the urinary tract but throughout the body. Ma'am, so
Hello, ma'am. My first question is fibrinolytic drugs. Fibrinolytic drugs are also called the thrombolytic drug. These are the agents that is capable of stimulating the dissolution of the blood clot. Fibrinolytic drugs work by activating the so-called fibrinolytic pathway. This distinguishes them from the anticoagulant drugs, which prevent the formation of blood clots by suppressing the synthesis or function of various clotting factors that are normally present in the blood. The fibrinolytic system that exists in the human body is also involved in the lysis or dissolution of clots as wounds heal. The fibrinolytic drugs degrade fibrin and fibrinogen to products that act to inhibit the enzyme thrombin. The active enzyme involved in the fibrinolytic process is plasmin, which is formed from its precursor plasminogen under the influence of an activating factor released from endothelial cells. If found in the circulating blood, plasmin is normally inhibited by a circulating plasmin inhibitor. One of the fibrinolytic drug is streptokinase, which is produced from the streptococcal bacteria. When administered systemically, streptokinase lyses acute deep pain, pulmonary and arterial thrombi. However, the drug is less effective in treating chronic occlusions. When administered intravenously soon after a coronary occlusion has formed, streptokinase is effective in re-establishing the flow of blood through the heart and vessels after a heart attack, and in limiting the size of the area of tissue death. Streptokinase also can be administered directly into the coronary blood vessels to deliver a high dose directly to the site of the clot. Heparin, aspirin, dipyramidol, and combination of these three drugs can be added to therapy to help prevent the recurrence of occlusive clots. An overdose of streptokinase may lead to bleeding from systemic fibrinogenolysis, which is the breakdown of coagulation factors by plasmin. Kinase is another agent, which is a protease enzyme that activates plasminogen directly, is obtained from tissue culture of human kidney cells. Kinase lysis recently formed pulmonary emboli and compared with streptokinase, it produces fibrinolysis without the extensive breakdown of the coagulation factor. Tissue plasminogen activator stimulates the fibrinolysis and it has several important advantages over the streptokinase and kinase in treating the coronary thrombosis. It binds readily to the fibrin and after intravenous administration, and then activate only the plasminogen that is bound to the clot. Thus, fibrinolysis occurs in the absence of an extensive breakdown of the coagulation factors. It may be used to initiate the treating of the heart attack victims to the hospital, eliminating the time spent in the hospital preparing the patient for intracoronary injections of streptokinase. This is extremely useful because the rapid re-establishment of coronary blood flow is critically important to minimize the amount of the damage to the heart after a heart attack. An elevation in the level of the circulating plasmin due to excessive activation of the fibrinolytic system may result in the fibrinogenesis and hemorrhage. The antifibrinolytic drug aminocaproic acid is a specific antagonist of plasmin and inhibits the effect of the fibrinolytic drugs. Next question is the fibrinolysis. Fibrinolysis is a process that prevents blood clots from growing and becoming problematic. This process has two types, primary fibrinolysis and secondary fibrinolysis. The primary type is a normal body process, whereas secondary fibrinolysis is the breakdown of clots due to a medicine, a medical disorder, or some other cause. In fibrinolysis, a fibrin clot product of the coagulation is breakdown. Its main enzyme plasmin cuts the fibrin mesh at various places, leading to the production of the circulating fragments that are cleared by other proteases or by kidney or liver. In the process fibrinolytic drugs are used. They are given the following heart attack or to dissolve the thrombus blocking the coronary artery. And thrombolysis refers to the dissolution of the thrombus due to various agents, while antifibrinolytics such as aminocaproic acid and tranexamic acid are used as inhibitors for fibrinolysis. Their application may be beneficial in patients with hyperfibrinolysis because they arrest bleeding rapidly if the other components of the hemostatic system are not severely affected. This may also avoid to use the use of blood products such as fresh frozen plasma, which with its associated risk of infections or anaphylactic reactions. The antifibrinolytic apotropin was abundant after identification of major side effects, especially on the kidney. Then the next question is natural inhibitors of the fibrinolysis. Fibrinolysis is one of the principal defense systems against the development of thrombosis. Amongst fibrinolysis factors, the inhibitors, antiplasmids, and anti-activators play an important role in the regulation of plasma fibrinolytic activity and also modify the response to fibrin deposit. When thrombosis has developed and a fibrinolytic agent is administered, inhibitors of the fibrinolysis play a different role according to the type and the mode of administration of the thrombolytic substance used. The chief inhibitors of the fibrinolysis is the alpha 2 antiplasmin. It was isolated by the colon. Its inhibitory action is very rapid. It leads to immediate inhibition of the plasmin formed from circulating plasminogen. However, in the presence of the massive plasma concentration of the activators, the excess plasmin cannot be accommodated by the alpha 2 antiplasmins and is then capable of breaking down not only fibrin but also the fibrinogen and certain other clotting factors, leading to a risk of the hemorrhage. It is this which occurs following the administration of high doses of streptokinase or urokinase, or also during the endogenous release of the large amount of activators from the certain damaged tissues. When the plasmin is formed from the plasminogen bound to fibrin, it is protected from the alpha 2 antiplasmin and breaks down fibrin without the modifying the circulating fibrinogen levels. This occurs under normal conditions when a fibrin deposits in its contact with the vascular endothelial. Next question is the side effects of the fibrinolysis. Major common adverse effects of all the fibrinolytic drugs is bleeding complications related to systemic fibrinolysis and the lysis of the normal hemostatic plugs. The bleeding is often noted at a catheterization site, although the GI site and the cerebral hemorrhages may occur. Bleeding at the access site is the major side effect of the fibrinolysis. Damage to the blood vessel, migration of the blood clot to another part of the vascular system. Kidney damage in the patients also occur with the diabetes or with other pre-existing kidney disease. Done, ma'am.
Hello, ma'am.
Hello.
Ma'am, the topic in fibrinolytic drugs. Fibrinolytic drugs also thrombolytic drugs, any agents that is capable of stimulating the dissolution of blood clot, and fibrinolytic drugs work by activating the so-called fibrinolytic pathway. This distinguishes them from the anticoagulant drugs, which prevent the formation of blood clots by suppressing the synthesis of function various correcting factors that normally present in the blood. And the fibrinolytic system that exists in the human body is also involved in the lysis and dissolution of clots, wounds heal, and the fibrinolytic system degrades fibrin and fibrinogen are to produce that act to inhibit the enzyme thrombin. The active enzyme involved in the fibrinolytic process is plasmin, which is formed from the precursor plasminogen, and under the influence of activating factor released from the endothelial cell. If formed in the circulating blood, plasmin is normally inhibited by circulating plasmin inhibitors. after that, one fibrinolytic drug is streptokinase, which is produced from a streptococcal bacteria and administered systematically. Streptokinase plays acute deep vein, pulmonary, and arterial thrombi. However, the drug is less effective in treating chronic occlusions when administered intravenously soon after a coronary occlusion has formed. Streptokinase is effective in reestablishing the flow of blood through the heart and vessel after a heart attack and is limiting the size of the area of interest. Streptokinase can also be administered directly into the coronary blood vessels, deliver a high dose directly to the site of the clot. Heparin, diphenhydramine, or a combination of these three drugs can be added to the therapy to help the prevent recurrence of explosive clots and overdose of streptokinase may do lead to bleeding of from systematic fibrinolysis, which is the breakdown of the coagulation factor by plasmin. And the fibrinolytic agents are used to break down the thrombus, with the common agents being tank place, red place. Common side effects of fibrinolytic agents are hypersensitivity, reaction, and bleeding. And this is used for the fibrinolytic therapy, also known as thrombolytic therapy, is used to lyse acute blood clots by the activating plasminogen, resulting in the formation of plasmin, which cleaves the fibrin across links, causing thrombus breakdown. Okay, ma'am.
Anticoagulants of direct and indirect actions. Uh, It is the reversal of pharmacological anticoagulants is an issue that arises when an anticoagulant patient has major bleeding or when a patient on chronic bleeding uh, on chronic anticoagulant therapy requires urgent reversal of anticoagulation, for example, for surgery. The literature to determine the strategies are available to reverse anticoagulation caused by older agents such as warfarin or unfractionated heparin, as well as newer agents, for example, low molecular weight heparin, uh, danapiride, and ergotrobins. Its principles include specific antidotes exist for classic anticoagulants agents, protamine sulfate for UFH and vitamin K for warfarin. However, vitamin K only begins to reverse warfarin's anticoagulant effect by 4 to 6 hours. So urgent situations additionally require blood products such as plasma, fresh frozen, or cirrhosis superment plasma, prothrombin complex concentrates, or possibly recombinant factor 7A. A growing problems which is arises from the increasing use of new anticoagulants that lack specific antidotes. For example, protamine sulfate reverse only about 60% of the anti-factor 10A activity of low molecular weight heparin has a negligible effect on danopride, a mixture of anticoagulant glycosaminoglycans used to treat heparin-induced thrombocytopenias and a novel synthetic antithrombin binding pentasaccharide with exclusive anti-factor activity draw approved in the United States for the antithrombotic surgeries. Its includes the anticoagulant agents generally lack specific antidotes, thus careful choice of an anticoagulant agent and laboratory monitoring were appropriate are needed to minimize the risk of bleeding complications. The next question is fibrinolytic drugs. Fibrinolytic agents mainly include the use of thrombolysis are mainly used to stop the thrombolysis effect in several indications, including acute ST elevation, myocardial infarction, acute pulmonary embolism, and acute ischemia stroke. The pathophysiology of each condition is discussed as well as it's discussed in is discussed as that the ischemia strokes. The pathophysiology of each condition is described as the uh, thrombosis and coagulation cascade, which comprises in an extrinsic and intrinsic pathway leading to a common pathway or outline. Commonly used fibrinolytic agents include retiplase, atiplase, and each fibrinolytic agent is reviewed, including indication for use, mode of action, method of administration and side effects, and constant indications. And this enables to prevent the fibrinolysis, and it is the major role in fibrinolytic drugs. The next question, ma'am, the mechanism of fibrinolytic activity. It is called as the mechanism of fibrinolytic activity is also called as fibrinolysis. Fibrinolysis is a process that prevents blood clot from growing and becoming problematic. This process has two types, primary fibrinolysis and secondary fibrinolysis. The primary type is a normal body process, whereas secondary fibrinolysis is the breakdown of clots due to medicine, medical disorder, or some other cases. In fibrinolysis, a fibrin clot, the product of coagulation is broken down. Its main enzyme, plasmin, cuts the fibrin mesh at various places, leading to the production of circulating fragments that are cleared by other proteases or by the kidney and liver. Its in physiology of action of fibrinolysis include plasmin is produced in an inactive form, plasminogen in the liver. Although plasminogen cannot cleave fibrin, it still has an affinity for it and is incorporated into the clot when it is formed. Tissue plasminogen activator and urokinase are the agents that convert plasminogen to the active plasmin, thus allowing fibrinolysis to occur. TPA is released into the blood very slowly by the damaged endothelium of the blood cells, such that after several days, when the bleeding has stopped, the clot is broken down. This occurs because plasminogen becomes entrapped within the clot when it is formed. As it is slowly activated, it breaks down the fibrin mesh, and urokinase are themselves inhibited by plasminogen activator inhibitor 1 and plasminogen activator inhibitor 2. In contrast, plasminogen further stimulates plasmin generates by produce more active forms of both tissue plasminogen activators and urokinase. Alpha-2 antiplasmin and alpha-2 macroglobulin inactivate plasmin. Plasmin activity is also reduced by the thrombin activable fibrinolysis activator inhibitor, which modifies fibrin to make it more resistant to the TPA-mediated plasminogen. Its major roles in disease control are few. Congenital disorders of fibrinolytic system have been documented as the metabolic syndrome and various other diseases of the state. The next question, ma'am. Question number 4, features of the action of activator fibrinolysis. Features of the action of activator it includes the fibrinolysis, which is one of the principal defense system against the development of thrombosis. Amongst the fibrinolysis factor, the inhibitors, antiplasmins, and anti-activators play an important role in the regulation of plasma fibrinolytic activity and modify the response to fibrin deposits in the systems of the body. On the other hand, when thrombosis has developed, a thrombolytic agent is administered. Inhibitors for fibrinolysis plays a different role according to the type and mode of administration of the thrombolytic substances are used for this purpose. Main inhibitors includes in fibrinolysis are the antiplasmins and the uh, antiplasmins and fibrinolytic inhibitors. The chief of these alpha-2 antiplasmin was isolated by Colon. Its inhibitory action is very rapid. Its inhibitory action is very rapid. It leads to immediate inhibitory action of the plasmin formed from the circulating plasminogen. In the presence of massive plasma concentration of activators, the excess plasmin cannot be accommodated by the alpha-2 antiplasmin and is then capable of breaking down not only by fibrin but also by fibrinogen into certain other clotting factors, leading the risk of hemorrhage, which occurs following the administration of high dose of streptokinase or urokinase or during the endogenous release of large amount of activated from certain damaged tissues. When the plasmin is formed from the plasminogen bound to fibrin, it is protected from the alpha-2 antiplasmin and breakdowns into other products without modifying circulating fibrin fibrinogen levels, and they cannot further affect the amount of the fibrinogen level in the body. The next question is include the side effects of the fibrinolysin. Fibrinolysin side effects mainly include fibrinol. Common adverse its side effects of fibrinolytic includes the thrombolytic drug is bleeding complication related to the systemic fibrinolysis and lysis of normal hemolytic plugs. The bleeding is often noted to catheterization site, also gastrointestinal and cerebral hemorrhage that occurs the side effect of this drug, which is fibrinolytics. That's all.